Lebanon's once celebrated health sector is crumbling. Inflation, poor management, and corruption have left the country short of even the most basic medication. People have been forced to rely on Facebook groups to get their hands on leftover drugs. And in hospitals, medical equipment is running low to the point where doctors are turning away patients. Dr. Hadi Mourad is a physician and a researcher in epidemiology. We reached him in Beirut.
Dr. Mourad, can you just paint a picture for us of how bad and how widespread is this medicine shortage in Lebanon?
Actually, this government in Lebanon, after killing the people in 4 August explosion, right now, those people are trying to kill people's health very, very slowly. So they hit the health sector from all its sides. I mean, right now, doctors are immigrating. Now the pharmacies have no medications in their pharmacies. Nurses cannot inject medications for people in the hospitals because of the lack of the medications. Now the lab technicians cannot even do labs for the patients because lab kits are not available. So right now, all the medical sectors and the medical sector entities and pillars are being in need and in very, very, very shortage for everything.
Now, but the medications there was a shortage after the explosion. You just mentioned that to remind people what happened in Beirut.
Exactly.
But it's worse than that. What has happened since that explosion that's made the drugs even less available?
The main problem in Lebanon is the central bank issue because, the central bank is subsidizing those important and essential needs for the Lebanese people. And medications is on the top of the list. And now, because those medications were subsidized on the Lebanese currency, however, outside Lebanon, those medications, the prices of those medications is 10 times and 20 times the price in the country. That's why many of those medications, essential medications, have been lost from the Lebanese market because they were being exported illegally. Between quotations, they were smuggled outside the country through the illegal borders from Lebanon to Syria and then to Iraq. And the people suffered the lacking and suffered the death of their relatives, families, parents, and even kids because we have no access on those medications. Even the milk for the kids have been shorted so much. People right now, mothers are crying hard in order to get 1 box of milk for their kids, for their babies.
Who is doing this? Who is taking the drugs and things and the medications and smuggling them out of Lebanon?
Yes, unfortunately, there is a cartel of medications in Lebanon, and those are the dealers who are being actually governed and covered and protected by the mafias of the government, especially the Ministry of Public Health. When the Ministry of Public Health is being governed by a political party, and those try to gain profits on the expense of the people's health. For example, the Minister of Public Health right now cannot sue any smuggler, cannot sue any of those people who are killing Lebanese people's health. So they are dealers that are doing so in order to gain profits and actually getting benefit from the hyperinflation of the lira, and in addition making benefit from the inability of the central bank again to subsidize those medications because the central bank right now lack the funding actually for helping people, for the aim of helping people and subsidizing their needs.
I know you doctors, many of them are protesting against this and trying to get the ministry to do something. How has the health ministry responded?
Right now, the Ministry of Public Health has done nothing, has done literally nothing. Actually, they are putting the blame right now on others. They are putting the blame on the central bank. They are putting the blame on the syndicates, on the agents. They are putting the blame on everybody, but not holding the responsibility for the major catastrophic event that's happening right now. In addition to that, they have no concise emergent plan for putting a specific list of the 70 chronic medications that everybody needs in Lebanon in order to decrease the overload on the central bank.
I can hear the frustration and anger in your voice, Dr. Mourad. It's absolutely understandable from what you're saying. Can you give us some examples of the kinds of drugs your patients need and you can't provide for them?
Of course, I can give you many, many drugs. For example, people who are suffering from diabetes, they cannot find their glucophage or metformin or Janomet. People who are suffering from dyslipidemia, high cholesterol and triglyceride level, they cannot find Crestor or Lipontil or Lipitor. People who are suffering from heart medications, they cannot find their Aspicot, they cannot find their Concord drug or their Ritmonorm. People who are suffering from cancer, imagine cancer patients in Lebanon, they cannot get their medication. Cancer patients who are suffering from blood cancer, leukemia, or lymphoma, the medication which used to be subsidized by the Ministry of Public Health and the central bank, right now is 10 times the price before. So the cancer patient can die right now without getting their chemotherapy.
And examples from your own patients, just specifically, what are some of the worst stories you've had from people you can't help because of this?
It has happened 1 week ago. I have a patient of mine who visited me in the clinic, and I diagnosed her with, from the physical exam, with cholecystitis. It's an inflammation of the gallbladder. And I asked her to rush directly to the closest emergency room. She went to the closest emergency room, and after doing the imaging, they want to do a cholecystectomy for her, which is the removal of the inflamed gallbladder in the surgery. However, they could not find anesthesia. They could not find propofol or the ketamine. These are the anesthetic drugs which are used in the country. They cannot find it. That's why they tried to postpone her urgent operation for 2 days in order to get this medication or this anesthesia. In addition to the lack of the kits for the hemodialysis, people who are suffering from chronic kidney diseases. I have a patient of mine that does hemodialysis 3 times per week. Right now, he is postponed for 2 times hemodialysis. He can die because, the hemodialysis works as the kidney, as an artificial kidney, and you need to do it on usual basis. But now we don't have the kit for the kidney hemodialysis, and those patients are really dying. He is like 70-year-old, and he is begging me to do for him a favor, and I can do nothing. So this is what are the doctors right now are doing in Lebanon. They are just hearing the trouble of their patients, but can do nothing for them.
Dr. Mourad, you are a passionate advocate for your patients and for your country, and I appreciate hearing from you. I hope you are able to do something about this appalling situation. But thank you for speaking with us.
Thank you so much all for shedding the lights on this catastrophe. I wish everybody can hear our call right now. This is a humanitarian call that everybody has to put his hands on. Thank you so much.
We hear you. Thank you, Doctor.
Dr. Hadi Mourad is a physician and a researcher in epidemiology. We reached him in Beirut, Lebanon. And you can find more on that story on our webpage at cbc.ca/AIH.